Thank you. I'm also suffering, like everybody else, that we need to be quicker than we plan to be. I have to cram 45 minutes into 15. So I will talk slowly. My message today is that we have to think further. We started this morning beautifully talking about PrEP access. We were applauding that Spain has made PrEP formally available. And I'm all very happy about this. But I would like to turn your attention to a number of issues that are downstream and that I think that we already need to start thinking about today. I said this before, formal access is not given in a number of countries. PrEP uptake is low. There are special groups that are still fighting for access to PrEP. And I applaud everyone who is fighting to do this and helping to alleviate the situation. But again, my message is a slightly different one, and I think I would like to do this in 4 points. I just skipped one due to time reasons. And I want to talk about what we need to do to get informal PrEP users back into formal care. I want to talk about zero conversions on PrEP, and this is not about that PrEP doesn't work, but the behavior around it. I would like to talk about a concept that we call PrEP sorting, and I will explain it to you in a second. And finally, what can we do with HIV prevention after individuals stopped with PrEP, voluntarily, but most importantly, involuntarily? This may be a small group, but in our current situation, we also need to look at small groups, the last 10%, and they may be more difficult than the 90% we had before. So with no further ado, let me jump into it. This is a little bit like the genie out of the bottle. It was born out of necessity. We didn't have formal PrEP access in a number of countries, and a lot of gay men predominantly found other ways to get their hands onto PrEP, either by catching the bottle of their HIV positive friends who let it fall, by coming up with activist groups like I Want PrEP Now and others, and by traveling to countries where PrEP is available generically, where it's cheaper. There are a number of ways what you can do it, to even go to a sexual health clinic and say, I had unprotected anal intercourse yesterday, I need PEP, and then sort of take the Truvada out of it. So the genie is out of the bottle, and the question is, do we get the genie back into the bottle, and is that something that will come naturally? Because some people think the moment we have formal care available in a country, problem is solved, people will go back to this formal care. We have thousands of informal PrEP users in Europe and worldwide. We don't know their numbers. They're not registered anywhere. These individuals have often established very successful forms of getting their hands on PrEP and also using it. They're not always doing it in a bad way. They may have a slightly iffy way to get PrEP, but they may get their HIV test done every 3 months. They may find out their ways how to do their kidney test being done, and they do it in very good ways. So their access to PrEP is for themselves very successful. So why should they switch back? The formal care is often not very attractive. In a number of countries, if you want to switch to formal care, you're looking at months-long waiting periods, you're facing stigmatization, or you have to explain to a healthcare provider again why you should use PrEP while you have been using PrEP for years before. So would these individuals go back to formal care? And I had the amazing opportunity to survey 265 clients of Pulse Clinic Bangkok that use Pulse Clinic in Thailand to get their hands on PrEP. We didn't have a lot of time. It's not a comprehensive survey, but what could we ask them? Well, we could ask them a number of questions. And if you look at these figures here, about 50% say, well, I could access PrEP in my home country, but it is way too complicated. More than 60% say it is available in my home country, but it is still, even with the formal care, more expensive than getting it in Thailand and ordering it online. About 40% say, well, I couldn't afford PrEP because I would have to do co-payment, and that's more expensive than doing it there. 17% say the healthcare services are not gay-friendly. Even more, 22% say they wouldn't get PrEP because of the stigmatization. And finally, this is a community-driven activity. If your friends get PrEP at Pulse, you keep on doing that. If you ask me where these individuals are coming from, they're coming from the United States, from France, from the Netherlands, from Germany, all countries where PrEP is formally available. So to get the genie back into the bottle actually asks and demands for a lot of good formal PrEP provision, and we have to work on that. Otherwise, we will keep sort of a very large group of PrEP users out there that do not or may not get the PrEP care and medical supervision and help and support that they actually deserve. So this is my first point, take-home message. The informal users aren't automatically going to switch to formal use. To move on. Zero conversions on PrEP. We had the unfortunate luck to follow a number of cases of individuals that zero converted. And I just want to point them to you for those that are involved with providing PrEP care, what can happen. This individual is a perfect user. He has been using, oops, that's the wrong direction. Let me go back. Does that work? Oh, here we go. He has been a perfect user. He has been on PrEP for 2 years, and he did his tests, and it was all fine. And then he had this little hiccup where he had a little intermission of stopping PrEP and getting his hands back on PrEP, and he didn't have the sufficient window period of starting up PrEP for daily use, and he had unprotected anal intercourse, and we unfortunately had to test him HIV positive. After 2 years of perfectly using PrEP, the message is, take care of these individuals. Even if they do it well for 2 years, it may go wrong. It's not an automatism. Here's another case. A lot of self-tests going on. Some were positive, some were negative. Some doctor says, oh, that's a false positive, you're still negative, and so forth. And there was an unclear zero status in the context of PrEP initiation. And this person later on tested HIV positive. We could even find a resistance mutation with this individual. The take-home messages, especially if people test at home, if they use tests that are not as reliable or you are not sure, make sure that they are really HIV negative before they start. And finally, we have a casual user. He has a very unclear zero status, tests irregularly, has a number of symptoms that could actually look like an HIV infection already in 2016. He takes one pill of PrEP less than an hour before, has chemsex, and at least at that point zero converted, but we don't even know if he did that. He was already zero converted and at this stage. So especially in this informal PrEP use, there is a very big danger that individuals are starting with PrEP while they are negative. There are cases of resistance. It's not our biggest concern, but still, this should be done in a better way. Moving on to PrEP sorting. If you use Grindr, as I do, you find individuals that say, oh, group fun tonight, and you have to be fit, young, open-minded, and you have to be on PrEP. It's a prerequisite to participate in that group sex activity. On the other hand, you find profiles like this, and he basically says, no guys under PrEP, please. He is bottom, but he's most likely afraid of a higher bacterial STI burden or a risk of getting those. He doesn't want to have sex with individuals that are using PrEP. That's what we call PrEP sorting. Yeah, you have people that are absolutely looking for it, it's a prerequisite, or others that shun and discard potential sex partners that are not using PrEP. So how does that look in terms of data? We did this study together with my amazing colleague, Joel Martinez. He's a PhD student at Princeton University and an undocumented migrant. So he'll be one of the most highly qualified orange pickers if Trump doesn't change his legislation. Amazing guy. We did this study, what we called PrEP sorting, and we looked at who is actually a preferred partner. You can read the whole paper in AIDS Care. It came out earlier this year. I just want to show one snapshot. People living with HIV and PrEP users, these columns, they actually prefer monogamous PrEP users as sex partners. Non-PrEP users here, there is an interaction with promiscuity, having a lot of sex partners. That's what we pitted against PrEP use. And there is a higher preference, what you can see over here, these two bars, for monogamous partners, but not necessarily for PrEP users. So in a wrap-up, people living with HIV and PrEP users prefer PrEP users, but non-PrEP users not necessarily seek PrEP users that are actually more safe sex partners. So there is something to do and to get engaged in. Now, my last point, and I think most closest to my heart at the moment, and I have 4 minutes, 30 seconds to talk about it, is HIV prevention after PrEP. And the reason why I talk about it is that we had this beautiful formula in the WHO policy brief of 2015, which talked about seasons of risk. And there was an understanding that people would move into a season of risk and ideally take PrEP during that higher risk. But then the season would be over at a certain moment and individuals would stop taking PrEP. This was also put forward in the notion of event-driven PrEP, for example. So there is a seasonality. There is an understanding that we're not meant to take PrEP for the rest of our lives. And this may be the case. But the question is, aren't we putting people, and isn't our narrative at the moment, and I'm not saying it's bad, but we have to question ourselves, isn't our narrative at the moment very much a one-way road? Put everyone on PrEP, but we're not thinking, when do we get to that exit point when we actually have a good idea of when to stop with PrEP? Yes, I know it is when the risk is low, when people have a monogamous, safe relationship. But how many monogamous, safe relationships do you know? I don't know that many. So it could potentially mean we talk about a life on PrEP. This is not the case for everyone. PrEP use does not necessarily stop when the HIV risk is low. It can also stop when individuals are experiencing side effects that they don't want to experience and when they think, I do not want to take PrEP anymore. It could happen when financial or insurance hurdles are suddenly coming up and making PrEP use financially impossible, or when your stigma is so high that you believe, I don't want to take PrEP anymore because that's a way for me to avoid that stigma. So that could mean that you say, I say no to PrEP. Let's focus on the side effects. Again, I want to show you a case study that I published with my colleague from Bangkok. And it is a 56-year-old German MSM. In 2016, he started to take PrEP. His kidney function was kind of so-so, but he still got onto PrEP. In May 2016, his kidney function went down to 64. And his doctor started to worry. That was actually the first time we saw the patient. In November 2016, upon the advice of his doctors, he stopped using PrEP. Later in November, we detected secondary syphilis with him. We treated him with the typical two-shot treatment of penicillin. No, this is twice. I don't know why this is coming twice. In December, we could actually see that his titer was down, so he was non-reactive. His kidney function was still not ideal. He wanted to start PrEP again. In January, we found a new syphilis infection with this individual. Yes, and we treated him again. And we told him, you really have to change your sexual health practices and what you're doing because you're running really, really high risks. In April 2017, he was successfully treated for syphilis, but he was still HIV negative. His kidney function was so bad that he couldn't start with PrEP again. In May 2017, he had seroconverted. And I think this case shows clearly that individuals that are using PrEP for good reasons but have to discontinue using it are at a very high risk of seroconverting afterwards if we are not giving them the best care and love and supervision and counseling and information what they can do. We followed this up in the Netherlands with former PrEP users, and it's mostly 50-plus men who have problems with their kidney function. These are excerpts from interviews that we are running. So KJ is me. We asked, did you talk about your GP, your general practitioner, about your prevention after stopping with PrEP, or did he talk to you about it? And then the person says, haha. He put his stern look and said, do you know that you have to use condoms again now? And I looked him in the eyes and said, do you really think so? Another one says, after my question, do you use condoms? No. He says, yes and no. It should be more. But it's difficult. I think it's really a shortcoming. They tell you to stop with PrEP and they don't tell you what to do then. And finally, what did your doctor tell you? Condoms, condoms, condoms. He just does not understand. I think sometimes something went wrong here. They promoted a drug without thinking about side effects and what to tell people like me. Everybody is just so happy about PrEP, but there are people left behind. I guess this is typical for our society these days. If you don't fit into the mainstream, you're left behind. And I asked him to explore, and he comes up with this criticism of the pharmaceutical industry. And I think this is really an important notion that we have to understand. People may have to stop with PrEP, and we can't just tell them, oh, guys, use condoms. They may not have used condoms before, they may have stopped using condoms, and the message is too simple. And if we want to offer comprehensive and working HIV prevention, we need to think about these cases. To sum up, well, I don't have time for this. You can read it. We came up with an idea that we need to give them knowledge about all potential prevention possibilities, also partner PrEP use. This is also what David talked about. There is prevention and there is a protection due to sort of the swarm, the population you're living in. We need to increase communication skills that they can address HIV status and prevention options with sex partners. And most importantly, we have to empower them that they can say no, that they can say no to an individual that proposes sex that is not fitting their HIV prevention strategy. So they can basically say, I'd love to have sex with you, but I'm sorry, it's not going to work, or we have to do something else. I'm over my time. Thank you so much. My message is PrEP is more than access and uptake. We have to think further. If you want to discuss it, I'm happy to do with you. Thank you.